PCOS is something a lot of people have reached out to me about. It is becoming more and more common in women. PCOS is when you have cysts on your ovaries and or hyperandrogenism, meaning that your testosterone levels are high or you have hair growth in areas you don't want it, like your chin or your lip, and or cystic acne. In addition to that, you have metabolic syndrome, which means you have high cholesterol, you have insulin resistance, and or you have irregular menstrual cycles. So there are actually 3 different things you look for: irregular menstrual cycles, hyperandrogenism, and cysts on your ovaries. You have to have 2 out of the 3. And so there's a lot of women that meet this now because a ton of women have irregular menstrual cycles because our cortisol and insulin are out of whack. When your insulin and cortisol are high, it drives a lot of other issues as well. But when you have PCOS, you don't have normal menstrual cycles, and it affects fertility, it affects weight, it affects mood, and a lot of other things. And so it is becoming more common, and a lot of people are saying, oh my gosh, how do we treat this? Now, the sad thing about PCOS, birth control is not a good option. So they will tell you, they meaning GYN doctors and primary care doctors will say, with PCOS, you want to normalize menstrual cycles. That's part of their goal in treatment. And so the way they want to do it is give you a pill. Let's give you birth control. Giving you birth control is not going to normalize your cycle. I mean, it is, but it's doing it synthetically. So it is giving you a pill and it is tricking your body into thinking, okay, there are hormones available, they're not. There are hormones available, they're not. And so you will bleed. But that's not fixing the problem, okay? The problem with PCOS and the reason you stop having normal menstrual cycles is because your insulin and your cortisol levels are out of whack. And so you have other things going on. Your gut's inflamed, your thyroid's off. What's frustrating to me is instead of doctors using their brain and saying, okay, this girl's not having normal menstrual cycles, let's figure out why. Let's look at her thyroid. Let's look at her hormones. Let's figure out why she's not having menstrual cycles. They just throw a pill at you like, oh, let's take this synthetic birth control, which then we know when they get off of it years later causes more issues with infertility and other things. So I guess I'm very frustrated as well as a lot of people with PCOS because we don't treat it appropriately in this country, in my opinion. PCOS, let's talk about it. So when you have PCOS, you're not having normal menstrual cycles. Why? When your insulin's high, what happens to your estrogen? When your insulin's high, your estrogen is low. So insulin and estrogen are on a teeter-totter. They can't both be high. So as you develop insulin resistance, your estrogen level is going to go down over time, okay? You don't want to have low estrogen levels. You want your estrogen to cycle. When your estrogen is low, you're going to have issues with food cravings. You're going to crave sugar. Your weight's going to be more difficult to control because when your estrogen's low, your insulin's high. When your insulin's high, you're going to retain water and it's going to be more difficult to lose weight. So as these girls develop insulin resistance and their estrogen goes down, then obviously they're not going to have normal cycles. And then as their insulin goes up, their cortisol levels are going to go up because their body gets stressed. It says like, why are you not having a period? So then cortisol starts to rise. And when cortisol rises, that's on a teeter-totter with progesterone. So as your cortisol goes up, if you have PCOS, then your progesterone goes down. So then what happens at that point? Well, when your progesterone's low, you're going to have issues sleeping and you're going to have issues with your mood. And guess what? You're not going to have normal menstrual periods. So PCOS, like just going back to the basics of PCOS, I'm having irregular menstrual cycles. How do we fix it? It's not birth control. It's let's figure out how do we lower insulin? How do we lower cortisol? Are thyroid hormone levels accurate? Like, do we need to look at T3 levels? Do we need to maybe give their thyroid a little bit of support so that they can make estrogen and they can make progesterone? And so PCOS is very frustrating the way it's treated right now. And I know there's a lot of you reaching out to me. And so, what can you do? Well, what I recommend for my patients with PCOS, and obviously you should talk to your doctor, we try to get them off birth control. Like, let's stop the synthetic birth control, because that in itself can raise your cortisol. I see girls all the time with elevated cortisol levels, and I can prove it's from their birth control. And so we try to stop birth control, and then let's look at, okay, now what are our insulin levels? What are our cortisol levels? And let's focus on getting those levels to go down. Let's lower our cortisol. Let's lower our insulin. As we do that, then our estrogen should go up and our progesterone should go up. As our progesterone goes up, our mood gets better, we sleep better. When we're sleeping better, our insulin goes down. We start to lose weight. As our insulin comes down and our estrogen goes up, our periods start to normalize. We're not as hungry. We don't have food cravings. So that's how I approach PCOS. It's not let's just throw a pill at it, which is how a lot of people approach menopause as well with women. And we can talk about that separately. But throwing a pill at PCOS and especially birth control is not the answer. Let's get the insulin levels to go down. Let's get the cortisol levels to go down. Let's do it through lifestyle modification. Let's not do it with birth control.